So my name is Stephen D Clements Jr. I was born in Noonan, Georgia. I went to high school at Meriwether High School in Woodbury, Georgia. I went to college at Georgia Institute of Technology. I went to medical school at the Medical College of Georgia. I did all my training at Emory, primarily at Grady Hospital. Then I went in the Army for 2 years in the Medical Corps, and after that I came to Emory. I heard about the Emory Clinic when I was, growing up. I think that people throughout Georgia knew about Emory then, and the Emory Clinic and the physicians at Emory. And it was a referral hospital for this entire state. So I had heard about it then. Well, I did all my training here, primarily at Grady, and I liked the setting. I liked the academic atmosphere. I liked the collegiality, and I liked the people. So I targeted that as a place that I wanted to come and work and spend my career. (1973). I did have early mentors here. They were, the top of the list was Dr. J. Willis Hurst. He was the mentor to a lot of us here. And I subsequently was chief resident in medicine at Grady and fellow in cardiology. And he, of course, was my mentor and was my mentor going forward. I had other mentors also. As I started my career, I worked side by side with Dr. Bruce Logue. As a matter of fact, my office was between that of Willis Hurst and Bruce Logue for about 7 years. So I knew them both well. They were very good to me, and I tried to learn from them. In some of my earlier days at Grady, I had a number of mentors also when I was a house officer. And that included Dr. Nanette Winger and Dr. Robert Chalant and Dr. Don Nutter and a number of other faculty members who were very instrumental in all of my training. Well, Dr. Hurst taught me a lot about thinking about medicine and medical problems. He taught all of us about how to approach problems, how to think about problems, how to analyze problems, and in a way that would include all the possibilities and hopefully come up with the right answer. Dr. Logue was he was a tremendous clinician, and he taught us all about how to make a diagnosis, how to decide what's important, and how to pick out the right direction after you did that. In the background of that was our surgical team in the early part of my career under the leadership of Dr. Hatcher, who started really a new era in surgery here and put us on the map with our cardiac surgery. He, along with Dr. Ellis Jones, Dr. Joe Craver, and Dr. Robert Guyton. Dr. Logue was a very, very smart person. He was very intelligent. He had studied hard. He early on had gathered the experience of having patients referred to him from throughout the state with a variety of problems. And from that, he continued to learn and grow, and in addition to that, he was a great teacher. So he had many followers around, you know. Toward the middle and latter part of his career, he would attract all kinds of people that would follow him around, that knew his diagnostic skills and learned from him. Well, I've been here long enough to have mentored a lot of our cardiac fellows, our residents, our interns, and our students. And I think I mentored them, and sometimes it's hard to know. But occasionally you get a cryptic little note back from one of them, maybe from California, New York, and they pass on a thank you for whatever you did to them. Sometimes you don't even remember what you did, but the thanks and the recognition of what you did sometimes comes in those kind of packages. Well, of course, I remember Dr. Hurst and Dr. Logue. I remember Dr. Spaulding Schroeder, who was a gastroenterologist. He was a wonderful person, great gastroenterologist, knew how to cut to the chase of problems and come out with the right answer without going in circuitous pathways. I did not know Dr. Wood. I did not know Dr. Scarborough. I have known Dr. Jennings as he's come back here from where he practiced after leaving in Gainesville. Those are the main ones that I have known. I heard about Dr. Scarborough. I know that he was a great clinician and a great surgeon. And I know that toward the end of his life, he developed jaundice. And he himself recognized quickly that he had painless jaundice. And he knew that he had pancreatic cancer. And of course, he died of pancreatic cancer. I know that he liked to go down to Mr. Woodruff's farm and go fishing. Because as I have been down there, I've seen some of the pictures of Dr. Scarborough holding up a fish that he caught out of the Itchaway-Notchaway River. So, and I know that he was very close to Mr. Woodruff as this clinic was developed. I should say that another one of my mentors here was Dr. William McGarity, along with Dr. Richard Amerson, who was general surgeons here. Dr. McGarity and Dr. Amerson were both friends of mine. In a way, they were patients of mine also. Dr. McGarity was very close to Mr. Woodruff. He used to be one of Mr. Woodruff's physicians. And Dr. McGarity, in turn, was invited by Mr. Woodruff down to Itchaway to go quail hunting, which was a Southern tradition. Dr. McGarity after Mr. Woodruff's death, Dr. McGarity invited a number of us down hunting. We would come for very brief periods of time. That would include Dr. Craver, myself, Dr. Hendy, sometimes Dr. McGarity's sons, and we would go down for one day or day and a half of quail hunting, just like Mr. Woodruff did. And I consider that a great privilege to have done that. Well, the Emory Clinic, of course, was one of the first large group practices in the state. And when it first was founded, the general principles of the practice of medicine in this state and in this country were those of individual practices. And out of this hospital over here, and what started out as the diagnostic clinic, of which Dr. Logue was one of the early members, and the Winship Cancer Clinic, that was one of the conceptions of Mr. Woodruff with Dr. Scarborough right in the middle of it. And the combination of those two gave rise to the Emory Clinic as we knew it then and as it has evolved today. Well, I think there were just a few small groups around, and there were no large clinics around. I suppose the Mayo Clinic, the Oshna Clinic, the Cleveland Clinic, perhaps some of the clinics in New York were operative then. I'm not sure exactly how the time frame of their development corresponded to the time frame of our clinic. Well, when I arrived, the Emory Clinic was going full blast. And Dr. Hatcher had arrived, Dr. Logue was very active, Dr. Hurst was here, Dr. Ellis Jones had arrived, Dr. Joe Craver was arriving, Dr. Guyton was not far behind, and from our standpoint, we were trying to develop the heart surgery program under the direction of Dr. Hatcher. And it's Dr. Hatcher and his leadership through that help us develop our heart surgery program. And that developed into something that is quite a phenomenon today. And so that was instrumental in helping us get on the map. Well, the clinic spawned out of Emory University Hospital and the combination of the diagnostic group and the Winship Clinic group, and they're getting together with a lot of negotiations with the university, the dean of the medical school, and their combination led to the formation of the clinic. There was opposition in the city to that because of the thoughts that there should not be group practices, they should be individual practices. But the Emory Clinic was formed out of those groups, and it went forward from there. And it was eventually integrated into the medical school, and that led to the Emory Clinic as a primary practice mechanism of our Emory University School of Medicine now, and that's where we are today. Well, in the early days, the clinic started with the principles of being part of the School of Medicine, of donating teaching services to the School of Medicine. It was developed also with the idea that we would offer financial support to the School of Medicine. And that has continued to develop and led to where we are today, which is basically a part of the university, an integration into the medical school, full integration in which for the most part we all are faculty members, and that evolved into, in the current healthcare environment, Emory Healthcare, and the next generation of where we're going with medicine at this university. Well, some of the greatest successes have been, to my way of thinking, the heart surgery program and the cardiovascular disease program, our development of our cardiac catheterization laboratories, cardiac intervention, and cardiac surgery, and the integration of those programs leading us to where we are today. Well, Dr. Logue was one of my favorite stories because he was such a legend as a clinician. And all of our cardiac fellows, residents and interns and students followed him along. They learned from him, and the speed with which he made a diagnosis was unparalleled. And I remember one time I had, when I was a fellow, I was preparing to present to Dr. Logue. And I had this patient already in the hall to bring in to Dr. Logue, and I was going to give him the information in bits and pieces. And I figured maybe after I gave him a few pieces, he might make the diagnosis. Well, I invited the patient in the room, and Dr. Logue immediately said, "The patient has aortic stenosis." Dr. Logue, how did you know that? How did you know that so fast? And he, of course, was correct. And he had that kind of intelligence and experience that allowed him to do that. So that was always amusing to hear those stories about how he made a diagnosis. Well, he knew he was a male, and he knew that we were talking about valve disease that day, and that allowed him to give a best guess, which happened to be right. Well, our future depends on our development of our programs, and we've got to continue to develop all of our programs. We've got to develop our cardiovascular disease programs, continue to develop our surgery, continue to bring forth the latest and greatest for our patients. We also have to have a research arm, and that research arm has got to develop new things on the bench, and they've got to be taken to the bedside. Not only in cardiovascular disease, but we're very proud of our cancer program here. And we're an NIH designated cancer center. We've got to continue to develop along those lines. And we all realize that to be successful, you have to grow in all areas. Number one, you got to grow in the area of teaching. You got to grow in research. You got to grow in the area of patient care. And we've got to strive in each one of those areas to do the best we can as we go forward with our university and our clinic.